Good morning, Dr. Giambini. Welcome to another installment of MD America's interview series. We are so happy to have a seasoned international physician who currently works as the medical director of MDabroad, a company that is based in Aventura, Florida, and in Buenos Aires, Argentina, with offices in Brazil and in Mexico and Costa Rica. Dr. Giambini, welcome.
Yes, thank you for the invitation. And I'm here to clarify some issues you are interested in.
Dr. Giambini, our guests usually begin by sharing a little bit about their background, about their professional background, about their personal background. Please let us know, what is your professional experience? What are your expertise in medicine?
Primarily, I made my residency in Argentina in internal medicine. Then I specialized in emergency medicine and then in intensive care. I am a specialist in legal medicine and forensic sciences. I mastered in health systems and organizations of health systems. I work for private clinics, private hospitals. I was the director of those institutions. And I work for several international companies and local companies, insurance, private insurances, and public insurance companies. I'm working right now as a medical director of MDabroad, which is my main company right now.
Thank you very much. A very impressive background. You know, the interview today is less about MDabroad or that company or another company, and it's more about protocols. How does a medical director balance the responsibility to the client with the ethical and fiduciary responsibility we have to the patient and to his provider?
Your question should be divided in some different perspectives, because it's not the same an insurance company coming from Europe or South America or the United States. They work completely different, and they are expecting from us different procedures. Medical necessity is the main purpose of evaluation in our cases. And not only medical necessity, for example, timely procedures has to be done in a timely manner. When you are waiting for some consultation 2 days, and after that you decide to operate the patient, well, you are waiting 2 days that the company will be obliged to pay. So we are dealing with this aspect too. In the United States, that doesn't happen, but in other countries, it's very common. So we need to deal at real time with the hospitals or private company just to push them to do whatever is necessary before delaying any procedure or any medical assistance.
In the course of my work, I have come across doctors that were too eager. They say in our business, the right surgeon is a surgeon who is not in a hurry to operate, right?
Almost.
Can you illuminate a little bit about how does a person like you, an experienced medical professional, begins to do the process of investigating these two issues without offending anyone?
Yeah, what you say is right. There is a big difference in different countries about the behavior of physicians. I am not criticizing their behavior, but I noticed that it happened. So medicine, health systems today is a business. So and this business is being pushed by companies, by laboratories, pharmaceuticals, and we need to keep in mind that these are issues that happen everywhere. But with your experience, you are receiving information about professionals or institutions that they work with guidelines and they follow international guidelines, which are very, very useful to us. For example, Canada, in Europe, in the United States, they follow a lot of guidelines, and we feel in that way, we feel that we are dealing with someone which is more trustful. In Latin America, this is very, very different. You find people, physician institutions, which are prideful, and people, physician institutions, where overbill is very common. Not errors, but overbilling is very common, mostly with insurance companies, private insurance companies, because for them, to have a private insurance company means that you could bill a lot higher than if you have no insurance company.
Can you give us one or two examples where your experience helped uncover unnecessary or even fraudulent conduct, either by patient or by physician?
A woman, 35 years old, she has a family history of breast cancer. So she has a mass, a nodule in one of the breasts. And because of that, she decided to do a bilateral mastectomy with prosthesis. So first of all, you have a genetical examination, and that determines if that procedure, bilateral procedure, should be applied or not. And we are talking about a lot of money in this for the company, for the payer. When you examine, for example, the gene that is involved in this patient, you notice that in this case, the bilateral procedure with implants is not necessary. It's not medically necessary, so it's fraud. That's aesthetic. And if it's aesthetic, he could do that if the patient agreed with this, and the patient could pay for that. But that's is their decision, is not ours. And we are acting on behalf of the payer.
Can you provide the audience with an example of a cost containment result, which was really about good medicine, but also good financial outcome?
Well, yes. In fact, in the escalation of the cases, we have a lot trying to get some discounts, and that's the one of our main activities in this company. So we try to, sometimes we got that with a contract with providers, but sometimes we need to deal with them because we analyze errors, overbilling, delays, etc., impacting in the total bill. According to what we analyze, we are finding some problems, we can call that, for example, errors or overbilling with a medication or overbilling with labs or CT scans. And sometimes we can do that, lowering the final amount for the payer.
Can you give the audience a sense of which are the most challenging countries for you to serve in your capacity?
We could find along the way is that several countries or several locations, they have cartelized the prices. And it's very, very difficult to fight with them. One of the examples could be in Cancun, in Mexico. The worst maybe is Dominican Republic. They are cartelized. So they are all working together with the same pricing and copying the codes and the prices here in the United States, in Dominican Republic, which is crazy. It shouldn't be.
In a country like Brazil, should assistance companies pay a more attention to just getting access than to negotiating prices? Is access everything?
I think both are important. Sometimes it's very difficult to get access somewhere, and sometimes when you got that, it's very difficult to replay or to reprice the case, because as I told you before, when they know that you are a private insurance, there is a culture in many Latin American countries that you could bill whatever you want. The problem is that they never tell you in advance what their prices are. So that, and you can imagine that the same is happening here in the United States, that there is a federal law that it's supposed that any patient should have an estimate before receiving any service, but never happened.
I think that the more I hear you, the more I understand that the world is the same because it's about people.
Yep.
You will find these lapses, you will find these inequities, you will find overprices, you will find overbilling, and you will find overtreatment in almost everywhere. But the important thing is, what I'm hearing from you is a certain optimism, and the optimism is that as long as you approach the discussion in an honorable, respectable way that is based on criteria, that is based on comparable, you can have a dialogue with the provider.
Yes, always. Always. And it's very, very necessary. It's very necessary because, in fact, in between you have the patient. There is always a patient. And the patient is waiting and trusting more in the physician than us. So, and we are in between with the payer in our back, and we need to be truthful for all the parts, all the participants here.
I want to thank you for your time. I took much more than I told you that I will, and also thank our production staff in the studio that is in Buenos Aires. Muchísimas gracias, Gonzalo. Thank you so much.
I hope I would be I'd be useful to increase the knowledge of some people that they are imagining with fantasy or whatever, and they don't know the reality how it is.
I think that this was an honest conversation, and I thank you so much for being so honest and so balanced. Thank you very much. Have a very good day.